Okay, with that, let's discuss SMA. What do you need to know about SMA? You need to remember three things. Number one, SMA happens sa bata. It's a congenital disease or condition. It is, number one, progressive. Number two, affects the proximal muscle. And it is symmetric. Again, it is progressive. It is proximal. And lastly, it is symmetrical. Do you understand? Okay. Paranda sigla. Alright, so what happened here? The pathophysiology of your SMA is through this. Number one, there is a damage to the anterior horn cell. Number two, we will discuss this later. Number three, SMN mutation. What is SMN? Later, we will discuss what is the function of SMN to your anterior horn cell. And lastly, you need to remember that in SMA, it begins upon the birth pa lang sa bata or even sa tiyan ng mama, prenatal. It is already seen yung may problem na ang bata. And then after that, it depends. It can affect infancy, childhood, and adulthood. That's why SMA has 4 categories that we will discuss later. Do you understand? Okay. Now, let's discuss pathophysiology. Number 1. What do you need to know about SMN1? One pathophysiology of your SMA is that guba ang SMN1 sang bata or wala ang SMN1 sang bata. What is SMN1 first? Okay? SMN is known as survival motor neuron protein. So what is the function of this one? Normally, your SMN must be there to provide motor function to the brainstem and spinal cord. Is that clear? Now, what does it do again? Normally, hindi makomplito ang RNA sa motor cells without SMN. Do you understand? And it helps with the dendrites and axons for the motor. So what's the conclusion here? The summary of your SMN is that it helps progress and develops your motor neurons. Is that clear? Okay, thus, if madula ang amuni nga gene, the baby will present weakness. Is that clear? Okay. Madula. Okay, with that, let's proceed with question number 4 na loading. Kita niyo? Ay, lang kaya wala akong signal. True or false? Wala ka na answer Okay. For this one, kindly write true, kindly write false. Is that clear? Ito na nag-discuss. Kung kusiun, tagin ka mo ka rin. Okay, do you have the answers? Now, wait lang. Ang itakuan na yung interview. Okay, what's your answer? Okay, ano dapat ang answer? Very good. Okay. Another question number 5. Anong debilitating? Debilitating means it's severe. So, this is the severe form that causes debilitating symptoms, meaning lala na symptoms. Okay? That leads to death of a patient. So, ikaw, malalaki sa chapter, nasa pupunod ko, kasi may asking. Sila pala kasal ko. Alright. Alright. I think you got it right, man, Tanan. Wala may nag-change answer. So guys, here, listen. Okay, these are the types of and categories of SMA. Listen. We have an SMA 0, but this is very rare, but we will discuss this. But you have to remember this. If presented some choices nga mo ni, you need to choose, if you're asked, which of the following is the severe? You need to choose this one. Di ka paano ni sila? 1 is the severe. This is moderate severe. 3 and 4 are mild. This is the mildest. Is that clear? So you have to remember nga ang 1, if presented with these choices, ang wala ang severe. But, if my 0, you choose 0. Is that clear? Okay? At least for ano lang. Clear. Okay, with that, let's discuss. SMA 0, SMA 1. Okay. What do you need to know about SMA 0? Saan o siya ga-start? Prenatal onset upon sa womb pa lang sa mother. Is that clear? Another one, normally, ano ang presentation? What's the presentation of a patient if may SMA 0? There would be decrease or loss of fetal movement upon the third trimester of pregnancy. Is that clear? And then, what are the manifestation? SMA 0, pataha. When the baby is already born, you will have a severe weakness. You will have hypotonia, meaning the patient does not really have tone, wala. And after that, facial diplegia, both of the face is not able to move or paralyze siya. There is a congenital heart defects, and there is arthrogryposis. What do you mean by arthrogryposis? This is multiple joint contracture. Again, arthrogryposis is multiple joint contracture, meaning the patient already presents with this. The patient is not able to move. Do you understand? Okay, we will go back to SMA 1 later. But I want you to see the face of a baby if mabuhi siya. But normally, the baby will not last long, 6 months, mapatay na siya. Is that clear? Okay. This is what you call as arthrogryposis. This is multiple joint contracture. That picture is the facial diplegia. Is that clear? Okay. Now, let's proceed with SMA1. SMA1, what do you need to know? There are two names for SMA1, acute infantile SMA or the Wernicke-Hoffmann disease. Now, saan o siya ang konseptya? If SMA0 sa pagbata pa lang, ang SMA1 before 6 months, pagkagwa sa baby, it's like normal. But as the 0 to 6 months progress, you can see the manifestations such as there would be severe symmetric flaccid paralysis. The patient is not able to sit independently. Do you get what I mean? Meaning, if gusto nyo sila ipa-sit down, they need assistance. But they will not be able to... Wait lang, I have a question. Did you discuss the milestones na? Wala pa. Okay. So meaning, the baby, until magdako siya, will not be able to sit down. Do you understand? And lastly, can the baby survive? Yes, but such a mabuhi lang sila 6 months, 1 year, then die. Is that clear? So what is the reason for them to die? It's more on respiratory failure. Is that clear? Okay. Let's proceed. You need to remember this. Tongue fasciculation. Nga aga fasciculate ila tongue, guba man ila nga anterior horn cell. Okay? But you need to remember this. As your anterior horn cell degenerate, okay, lain ang fibers, get-twitch. Is that clear? So this is more on the degeneration of motor neuron that leads to the twitching of the tongue. Is that clear? So you can see that in patients with SMA. Alright, what else? Eyes on the screen for SMA 0. So, can the patient reach a milestone? No. Is that clear? Then usually, after 1 month to 6 months, they will just die. So, alright, na sila sa NICU. The ventilator will support them, the machine will support them. What else? These are the signs and symptoms that you can see on the patient. Number 1, polyhydramnios. Do you know what is amniotic fluid? Okay. Do you know that in the womb of the mother, there must be amniotic fluid, wherein the baby will swim there. But the problem here is that damo-damo ang fluid, gakastop ang bata sa kilid. Like, what is that? This one. This is polyhydramnios. Okay? The fluid is too much. The patient or the baby is not able to move. Do you get what I mean? Okay, next. What else? Intrauterine growth retardation. Normally, eyes on the screen, this is a normal baby, the pink one. But in a patient with SMA 0, they will have growth retardation. Why? Ano nga ba lang amniotic fluid? Katamaan ka dako, wala mayo nutrition ang bata. Is that clear? And lastly, we discussed already the contracture. Let's discuss pulmonary hypoplasia. Di ba duwa ka lang? Ang isa ka lang, so okay, ang isa gamay. In patients with SMA 0, this is the lungs. So they will really die kung wala mayo oxygen. Do you understand? Okay. With that, let's discuss SMA 1. Okay, SMA 1. Let's talk about milestone. They will never achieve the ability to sit unsupported, or they will not be able to sit independently. Do you understand? Another one. Are they able to make facial expression? Yes, meaning wala sila facial paralysis. Next, what else you need to know? That the patient will also have bulbar problems such as they will have a poor sucking and swallowing reflex. So for them to eat, what do they need? Kinabuhuan for them to eat here or ginabutangan sa tiyan, diretso na lang sa stomach. Is that clear? Okay. Now there is pooling of secretions, there is tongue fasciculation, and what's the risk of the patient here? Aspiration. Okay, hindi siya kaswallow. Okay? Alright. Let's proceed. Another note for SMA1. Basically, guys, ang i-discuss na sa babaw, amo na itong SMA0. Let's continue with SMA1. Number 1, the patient could die with respiratory failure. Now, let's discuss intercostal muscle is greater than diaphragm. What do you mean by this? The patient is not able to breathe using the diaphragm. They will breathe using intercostal muscles. Thus, they will have paradoxical breathing. What do you mean by paradoxical breathing? That upon inhalation, di ba usually mag-inhale ta diaphragm na, di ba? But, suli siya mong paradox siya. Upon inhalation, the chest and the abdomen move inward. While upon exhalation, the chest and abdomen moves outward. So, suli siya sa normal tanga breathing. Do you understand? With that, amo niyan sura sang bata. Okay, kita niyo na dyan. What's that? That is the, mga medicine, ang mga food dito sa tiyan. Do you get it? Okay. Sige. What else? Bell-shaped chest deformity. Since there is a paradoxical breathing and they're using their chest muscle, so gasuli ang ilang structures ng body. What is the structure of the patient? Amo na siya. That's a, what you call that? That is your bell-shaped chest deformity. Okay, another frog leg posture. So, abduct, externally rotated ang ilang legs, and they will, at some point, what's the problem here? It's more of respiration rather than cardiac ng mga problem. When you compare it to SMA0, there is a cardiac problem sa patient. Is that clear? Okay. Any questions? Clarifications? Let's proceed with question number 6. I already discussed that. Sige, ano sila? Can you answer mo? Okay, man. Okay.
Ang kailangan hindi ko i-direct.
Alright, everybody got it right? I already discussed this. The question is, severe fetus weakness, hypotonia, rare. So, if ang gina-ask is severe, may 0 ka 1, you choose the 0. It also depends upon the definition. Is that clear? So, 0 siya kay loss of fetal movement and the rare phenotype. Okay. Next. This is what ba ni siya discussion na? With ability to sit, but with support. Again, the patient presents with the ability to sit, but with support. Kinasulit ko lang naman. Wait na po. Alright. So the answer here is SMA 1. Kaya mo ba lang ang, gisulit ko lang na guys, the patient is not able to really sit down unsupported. So that's it. Ability to sit but with support. Okay. Alright. Now let's discuss other types of SMA. Let's discuss SMA 2 versus SMA 3. Okay. SMA 2, okay. SMA 2 is also known as Wernig-Hoffman 2. Okay? Same na sila. Ang SMA 1, Wernig-Hoffman 1. SMA 2 is Wernig-Hoffman 2. What else you need to know? Chronic infantile disease. Now, onset, yun ang pinaka-important. When will be the onset for SMA 2? Before 18 months of age. Is that clear? Ang isa, pagkabata, isa 6 months, ang isa 18 months. Before 18 months of age. Let's proceed with SMA 3. What's the other name of SMA 3? Kugelberg-Hollander or chronic juvenile form. Do you get what I mean? SMA 2, chronic infantile. SMA 3, chronic juvenile. Now, the onset. If the SMA 2 is before 18 months, the SMA 3 is after 18 months. Is that clear? Okay. Now, SMA 2 tanay-tanan. They are able to sit. Is that clear? But it is only delayed. So, for example, if the milestone of the baby normally 6 months makasit down, a baby with SMA 2 after a year. But they can sit down independently. Is that clear? And then, can they ambulate? No, they cannot. The only milestone that they can reach is sitting independently. Now, continue. So, they will not be able to walk or stand, and they will manifest with proximal and lower E weakness. Start with proximal and then go with lower E. Let's proceed with SMA 3. What happened here? They are able to reach the milestone. They can achieve all the milestone. They are able to walk without aid. Is that clear? And with that, yes, they will have proximal muscles and leg weakness. They will have abnormal gait, but again, they are able to walk. Is that clear? Okay, another. SMA 2 taanay. What are the signs and symptoms that you can see? Do they have diplegia or weakness of the face? Wala. Okay? Do they have tongue atrophy and fasciculation? Yes, they do. 1 and 2 may ARA. Is that clear? 3 can have but not really. Again, 1 and 2 can have tongue atrophy and fasciculation. 3 can have but it depends. Some of the patient can have, some of the patient cannot have that fasciculation. SMA 2 are reflexia, dysphagia, and respiratory problem. Now, if the patient will live long, since they are not able to stand up, what is the secondary complication? They will have scoliosis, and that scoliosis will lead to restrictive lung disease, and they will also have contractures. Is that clear? Bali, okay sila tani, pero since they are not able to sit down, there will be a lot of secondary complications. Is that clear? Now, let's proceed with SMA 3. They can walk, but of course, they will have difficulty in running and climbing stairs. They will have a difficulty in rising from a chair. And here guys, kung magtigulang na sila, since the muscles are weak, anong kakatabo? They will need to have a wheelchair, especially prolonged or community ambulation. You get me? Because they're still SMA. Their legs are still weak. So when they grow old, go weak na gid ang ilang legs. And after that, they will have scoliosis, but later. Do they have a normal life expectancy? Yes, compared to SMA 2, 1, and 0. Is that clear? Okay. So this is SMA 2. Wala na sa nila. Very floppy, panagya po nila ng legs. Thus, they're not able to really stand up. While this is SMA 3. Tanawan nyo, SMA 3 has problems kasi syempre may proximal weakness man gyapon. So they will have postural problems. They can walk, but gawadol na sila mag-walk. Is that clear? Okay. Now with that, question number 8. Floppy baby. Floppy. You know what floppy means? Severe flaccid paralysis, absent tendon reflex of floppy baby. Okay. Answer niya? Is-radio ka na lang. Answer niyo. +1 na naman ka mo. You change it. There's a word there that says it's not that. It's not the answer. Severe flaccid paralysis. Severe flaccid paralysis. Sige, Martin. Severe. There's a word severe. There's your answer. That's why no. Ay, cheat ko na. O kaya, wala ang kaso. That's wala. SMA 2 will manifest with Gets your mind kung ako? Okay. Guys, are you the answer here is 1. You get what I mean? Because there is a severe flaccid paralysis. Yes, SMA 1 and 2 can have the absent tendon reflex. A floppy baby means ang upper and lower wala gid po. You get what I mean? Ang SMA 2 kaya mga pumbo kaya lower bilang ang floppy. Okay? But there is a word severe flaccid paralysis and that is for SMA 1. Okay, next. Ayun naman. What is the debilitating symptom that can lead to patient's death in patients with SMA? Is it bulbar weakness? Is it respiratory failure? Is it weakness of the extremity? Or is it contracture? So, choose. Okay. Okay. So everybody got it right. The answer is respiratory failure. Okay. Another one. Naman ta. Okay, so what is your answer? Okay, the answer is SMA 3. Masala, pag-ibig. Letter D, wrong answer. Another one. So this time you have to write it. What form of SMA manifests with arthrogryposis, multiplex or arthrogryposis, and undeveloped lungs such as hypoplasia of the lungs? What form of SMA? Alright, so everybody got it right. SMA 0. SMA 0 will manifest with arthrogryposis and undeveloped lungs, which is hypoplasia of the lungs. Sige na lang, ako plus 1 na. Kailangan ko na. Kailangan na. Alright. Now let's discuss. Wala pa naman tapos. Mary, punta ka may Ari. Okay. Ano mo reason? Okay. Let's discuss SMA4. And what is this? SMA4 happens, for example, normal. Then after 30 years old, nag-weak gulpi ang patient. You get what I mean? Now with that, this is an adult onset SMA that happens before or later than 30s, 40s, 50s. Is that clear? Now with this, it happens at the 5th or 6th decade of the patient's age, and it has a milder form of impairment. Normally, hindi niyo siya nga dito sa SMA kung i-diagnose. Kung sa DDX bala, damo pa ni test to confirm if it's really an SMA. Is that clear? Now with that, what do we need to know about the clinical manifestation? Number 1, progressive proximal limb weakness and fasciculation. It might be the tongue or it might be the lower extremity. Then, the patient will manifest decreased or absent TTR. Do they have a respiratory problem? Not really. They will have generalized muscle weakness and wasting. Ang common na makita nila, fasciculation means get-twitch ang muscle. Okay? So they can see fasciculation or muscle twitching. Okay. With that, another one. Mansira nyo lang kung salapagid ka mo ya. Nerve conduction velocity. In patients with SMA, sensory nerve conduction velocity produces abnormal amplitude and conduction velocity. Gusto yan na naman ang makita. Oo. Masasalapagid ka na. May braso ka ulit, hindi ko magbuka. Okay, so the answer is false. Guys, sensory is not affected, but you need to remember this. EMG, electromyogram, And your NCV, nerve conduction velocity, normally kung SMA, it's the motor that is already decreased. Is that clear? Okay. Now with that, eyes on the screen. These are the medical assessment that you need to know. Creatinine kinase. I know CK level, normally sa heart problem, yun na namabatian. But you need to remember there are different types of CK. And the elevation of CK can also manifest as muscle wasting. Is that clear? If there is an increased CK, meaning ang muscle mo, grabe ang wear and tear, ang kidney gasaka ang iyang function. Is that clear? Now, with that, you will have NCV, the nerve conduction velocity studies. So, anong makita mo? Normal sa sensory, abnormal or decrease sa motor. Needle electromyography, or you call that as your EMG. Eyes on the screen, SMA1. Nga denervation without innervation. It means that, do you have an innervation of the motor neurons SMA1? Wala. So without the motor neuron, there will be denervation of the nerves surrounding that. SMA 2 and 3, anong nakatabo? Diba? The patient is able to sit, the patient is able to stand. But the action potential is prolonged. Normally, ang potential is that. But in a patient with SMA, action potential, prolonged, then action potential, prolonged, and action potential, prolonged. Do you get what I mean? In normal action, the action potential is this, and this. But in a patient with SMA, the action potential is prolonged. Thus, action potential, action potential, action potential. Is that clear? And last but not the least, we're not using the muscle biopsy sa una mo ni ang ilang daw ka task get. But now it's NCV and EMG. Any questions? Okay. Number 13. Pwede na rin siya testing of your short-term memory. Nabuta na nakabas. Yeah, okay na that girl. Ano review? Naligiman ay. Okay. Alright, so the answer is your letter C, EMG. Okay. Next. Meaning, which of the following will not lead to respiratory dysfunction or pulmonary dysfunction? Kung hindi ka makapala sa medical terms, yung bound ka. Ayan na, tapos mo sa bahat. Kamatiin na lang po. Ayan is Okay. Here. Okay. The answer is hyperoxemia because guys, may mia na gani, may hyper, but it's supposed to be hypoxemia and not hyperexemia. You get what I mean? Ano ay? Usually, if there is emia, it's supposed to be hypoxemia. So mucus plugging, aspiration, hypoxemia, and recurrent infection. Ay, nako. Okay, eyes on the screen. Let's discuss. Wala pa tamo, mapolio pa sa kalimdaman ng tatanan. Okay, so let's discuss complications after SMA. You will have pulmonary such as respiratory failure, death, pneumonia, hypoventilation, hypoxemia, fatigue, or LD. You need to remember hypoventilation can lead to hypoxemia. Musculoskeletal, you have contractures, dislocations, scoliosis, and pain. Now, what's the common complication after SMA sa musculoskeletal? It's scoliosis. Again, what is the common complication sa musculoskeletal? It's scoliosis. And others such as this, but normally it's more on respiratory problem. Is that clear? Okay. Okay. 3 complications related to SMA. May blood clots na kami dito. Ano naman ako sa ilaw? Exactly. Kuha na ang answer na kung pwede. Salamat guys. Kuha ang answers na pwede. Pero, kung namati ka mo, class ko, so nakakuha sa tsakto-tsakto, hindi answer. Wala nang mag-change answer ako. Okay, so, okay, let's go back. Do you see subluxation there? Yeah. But it can be because there's dislocation. The correct answer again is actually letter D, so class 2. Yes, but then there's really no subluxation. Okay, but it's okay. It's okay. The answer is B. That's why I said B and D. Okay. Pwede ba, Soy? See you sa Saturday. See you sa Saturday. Alright, let's discuss another one. And after this, we will have a break. Kay Mapolio na tayo. Okay? Until 25, see? Okay. This is the, ang mga pinakanawid. And this will be the last topic for prelim. You know why we did this? Because next week we will just have an exam. We will have an oral reva eh. Yeah.
Next week na?
No. Next week will be your quiz and just rest day. For the next week. I have not posted the February pang schedule. Is that clear? So you will have to something. Okay na. Let's go. Let's discuss the spinal bulbar muscular atrophy. Again, SBMA is also known as the spinal bulbar muscular atrophy. Its another name is Kennedy's disease, and you have to remember it's different from all SMA because it is an X-linked recessive. You get what I mean? Now with that, what happened? It is like SMA4, pero may laina siya ng manifestation later. So the patient will have a slowly progressive weakness with androgen insensitivity. Normally, affected are males, but there are androgen problems with this patient. What else do you need to know? So same sa SMA4, age 30 or late adulthood. Now with that, what are the clinical manifestations? There is amyotrophic proximal and distal weakness. There will be wasting of the facial, bulbar, and limb muscle, and sensory impairment. Is that clear? Now, ano pagit ang makita mo? Endocrine problems such as gynecomastia, what's that? The patient, yes, the chest, bali guys, gynecomastia is, there is the breast-like symptom sa mga male. Again, there is a breast-like symptom. So the patient is actually a male, but it's changing because there is an endocrine problem. Why? Because elevated si testosterone or progesterone leading to what? Meaning, the female galain ang body sa male patient with SBMA. And there is a reduced fertility. Okay, now, the reflexes are typically decreased. Okay, listen. How about for the creatinine kinase? Mildly increased, meaning my muscle wasting, and the patient, there is a loss of ambulation later in life. Is that clear? So, eyes on the screen for the difference. Eyes there. And then sila, same with proximal weakness, with tremors, fatigue, atrophy. But the problem is the inheritance. Ang isa, recessive, ang isa, autosomal dominant. What else? Disorder of the endocrine, SBMA. For the SMA, wala. Okay? CK. Sa SBMA, mas increase. Sa SMA, normal. And lastly, respiratory muscle affectation. Rare sa SMDA and common sa SMA4. Is that clear? Just follow the box and hindi ka mo madula for DDX. Get? Yes. Okay. It's because normally ang gene pala, the SMN gene is gamay lang, damo, or kulang. So for example, sa SMA0, wala, hindi SMN. Sa SMA1, may gamay, pero hindi maka-equip for the system. SMA2, medyo damo-damo, pero well, SMA3 may ara, pero weak. Is that clear? So it's more on the genetics, it's actually the composition of the SMN. Do you understand? Alright, with that. Correct manifestation of SBMA. Yes. Gusto mo quiz na, hindi ka sa bata mo. Sila na lang wala pa. Ano na? Wala ko kita. Ay, sila wala pa. Okay na. Okay. So, for SBMA, it's X-linked recessive and gynecomastia. That's it. Okay? So, listen carefully. Di ba nag-ambal ka nga? Reduced fertility. Meaning, ang sperm count ng patient with SBMA is very decreased. Is that clear? Alright, another one. Diyan na tapos, no? What possible intervention can improve the overall movement of a child with SMA? May it be 2. So we're talking about 2, 3. 2 and 3 ng SMA. So we're talking about 2 and 3 ng SMA, meaning nag-live di nga bata. Okay? May specific na, wala pala. Yan, siya ba ma-improve ang iyang movement? Wow! Wala pa ka mo, di ba? Oh, makita nyo na sa pidya nyo. Pinulubra ako sa mga bata. Choose the correct and appropriate answer. That's right. Okay, nakamula ka dito. Kung bata na siya, kung mabigyan ang kamot 2 years old, 1-year-old kid with SMA, what's the appropriate exercise for that? Think about the age. 1 year, 2 years. Hindi na makasing. Okay. So the answer is, normally, patient with SMA, so age nila is 1 year old, 2 years old, 3 years old, you will do head control or head and trunk control exercise and bed mobility exercises. Okay? Active and passive range of motion are not needed to prevent contractures in patients with SMA. In general. Not needed to prevent. Binalata ka mo din. Wala kayo sa bala? Hindi naman yung isli. Hindi pag isli. Ay, may DDX ka muna kayo rin. Nag-discussion. Sa plato. Kabalo ka? Okay. Guys, the answer is boys. Okay, now, the question siya po, hindi kayo contractors na, but as I said, guys, this is a general SMA. So, SMA 2, 3, wala pa man na contractors yun, diba? So, active and passive ROM is really needed for them as well as bracing. Is that clear? Okay, another one. Wala, pwede ka 25 na mo. More on discussion. Okay na? Okay, so bracing, such as lifting and bracing, are used to support the weak muscle and to prevent contractures. Okay, wala pa katapos. Gawa niya kasabat, ya? Breathing exercises. Cardiopulmo. General. So, pwede na yung SMA 3, SMA 4, SBMA. In general na na. Okay, tapos ka na. Okay.